So good morning, good afternoon, and welcome to today's congressional briefing on Moms in Crisis, how the pandemic and formula shortage have fed the maternal mental health crisis. Thank you for taking time from your busy days to be with us to talk about the important issue of maternal mental health. Next slide, please. My name is Adrienne Griffen. I'm the Executive Director of Maternal Mental Health Leadership Alliance, and I will be your host and moderator for today's session. Next slide, please. We're joined today by sister organizations 2020 Mom and the Shades of Blue Project, with support from the American College of Obstetricians and Gynecologists, the March of Dimes, and Mental Health America. We also are working in partnership with the Congressional Mental Health Caucus, the Bipartisan Maternity Care Caucus, and the Black Maternal Health Caucus. And today's briefing is made possible by generous funding from Sage Therapeutics. Next slide, please. A few notes about logistics. The presentation and recordings will be sent to everyone who participates via email following the briefing. And if you have any questions, you can contact Emily, our tech support, at erosenberg@mmhla.org. Next slide, please. Moms in crisis. What are we talking about? Well, before we talk about maternal mental health, we need to talk about maternal mortality and see where mental health fits into this. So the slide on the left, I'm sure many of you have seen before. It notes that the US ranks the last among industrialized nations in maternal mortality. And these rates continue to rise. In fact, during the pandemic, we saw that the rates of maternal mortality rose for all women in the United States, but particularly for Black women. You can see with that red circle. Next slide, please. And tragically, suicide and overdose are the leading causes of death for new mothers. Every time I say that, I feel like somebody's punched me in the stomach. These are entirely preventable deaths. Next slide, please. So maternal mental health conditions are actually the most common complication of pregnancy and childbirth. These conditions include anxiety and depression and other issues, and they affect at least 1 in 5 pregnant or postpartum people. We also know that certain high-risk groups, such as military mothers, BIPOC individuals, and those living in low-income neighborhoods, are impacted at rates as high as 40%. And we know that untreated maternal mental health conditions can have negative long-term impact on mother, baby, family, and society. We also know that the vast majority, over 75% of those who experience maternal mental health symptoms go untreated. And this costs our country a total of $14 billion each year in addressing poor health outcomes of mother and baby, lost wages, and productivity. Next slide, please. So besides the normal new mom stressors, moms over the last several years have faced an enormous amount of stress, starting with the COVID pandemic, when women who were pregnant or soon to be pregnant worried about how the virus might affect them, their pregnancies, their newborns, but then their whole lives were turned upside down. And women had to worry about, how am I going to work from home and care for my family and teach my children, all during the pandemic? And then as we have been emerging from the pandemic, there are questions about, how am I going to feed my infant with this formula shortage? And how am I going to keep my children safe at school? Next slide, please. Make no mistake, all of these stressors are having a huge impact on mom's maternal mental health. And how the mother does directly impacts the family. Next slide, please. Thankfully, people are listening and taking action. Over the last several months, we've seen that a national maternal mental health hotline was launched. That's a 24/7 hotline launched on Mother's Day this year. We know that Congress is taking steps to address the infant formula shortage, and the medical system is starting to address the rates of maternal mortality. Next slide, please. So here's a quick overview of today's briefing. We're going to hear from some congressional leaders, as well as experts in the field of maternal mental health, and a mother with lived experience who will share her story. There's a few pieces of legislation that you will hear referenced, so I just want to highlight those. First is Into the Light for Maternal Mental Health and Substance Use Disorder Act. This has two specific provisions, which is to provide grants to states to create programs to address maternal mental health, as well as funding the National Maternal Mental Health Hotline. The second piece of legislation is the Triumph for New Moms Act, which would create a national task force and strategy. And both of these pieces of legislation have been included in the House Energy and Commerce Mental Health Package, and hopefully in the Senate package. We also hear about additional policy programs and practices, particularly about funding community-based programs in response to the infant formula shortage. Next slide, please. We are first going to hear from two strong maternal mental health advocates. The first is Assistant Speaker of the House of Representatives, Representative Catherine Clark, Democrat from Massachusetts. Representative Clark has long been a champion for maternal mental health. In fact, she introduced the first legislation that provided funding for state grants to build out maternal mental health programs. Next slide, please. We will also hear from Representative Jamie Herrera Butler, Republican from Washington, who, along with Representative Clark, is leading Into the Light and other pieces of maternal mental health legislation. So we'll have a quick video from each one of our representatives.
With our moms, but we are
Sorry, folks, a few technical.
Hello, I'm Assistant Speaker of the House, Catherine Clark. I'm honored to join the Maternal Mental Health Leadership Alliance virtual congressional briefing today, even virtually. And I'm so grateful for your support for my bill, Into the Light for Maternal Mental Health. I don't have to tell you all that the health and success of families begins with our moms. But we are leaving too many without the care and support they need. Despite incredibly high rates of mental health issues during and after pregnancy, 75% of mothers never get treatment. It's simply unacceptable. I'm proud to lead the Into the Light Act to provide permanent mental health resources to moms across the country, from a 24/7 voice and text hotline to improved screening and treatment programs. Passing this legislation is an important step towards ensuring that no mom will suffer alone. So thank you for all of your partnership in the fight to promote the mental health of mothers and invest in health equity. The Maternal Mental Health Leadership Alliance's dedication to solving the maternal mental health care crisis inspires my work in Congress every day. And I'm so grateful for your support and advocacy. I hope you have a wonderful conference.
Hi there, this is Congresswoman Jamie Herrera Butler. Thank you for inviting me to take part in your Maternal Mental Health Leadership Alliance briefing. This is a great opportunity to come together and learn about solutions that could improve the health and well-being of moms across our country. As co-chair and co-founder of the bipartisan Maternity Care Caucus, my focus has been on increasing the well-being of moms and babies. One of our initiatives is expanding mental health resources for moms. Maternal mental health conditions, including substance use, are the most common complications of pregnancy and childbirth. Alarmingly, it affects 1 in 5 mothers during pregnancy or in the year following childbirth. Maternal mental health conditions are strongly related to maternal mortality. Suicide and overdose are the leading causes of death for new mothers in the U.S., accounting for 3 in 5 postpartum deaths. Yet these deaths are preventable. That's why I worked on the Into the Light for Maternal Mental Health and Substance Use Disorders Act. This bill authorizes grants to states for screening and referral of moms with maternal mental health conditions. It also authorizes, for the first time, the newly launched 24/7 voice and text maternal mental health hotline. I am so proud to have worked on both of these initiatives to help moms in crisis. Thank you so much for inviting me to speak with you and for working alongside us to pass the Into the Light Act. Thanks and take care.
Again, we are so grateful to our congressional leaders for moving these issues forward, paying attention, writing legislation, and providing funding. So it is my honor next to introduce Mariel Mendez, who is the mom of two beautiful little girls. She lives in Seattle, Washington, and she's going to talk to us about her experience.
Good morning and good afternoon to you all. As Adrienne mentioned, I am Mariel Mendez, and I am the mother of my daughter Milea, 3 years old, and Camila, almost 1 year old. And today I'm here to share my story, a story that represents a shared experience for 1 in every 5 women in this country, a shared experience for almost 800,000 mothers in our country. I remember gasping for air and feeling foreign to myself. I had my first anxiety attack when I was 7 months pregnant with my first child. I didn't have the words to explain to my husband, to my mother, or to my friends what I was feeling. Everyone said it was normal to feel stressed with the arrival of a new baby, Milea. But normal? I didn't know what normal entailed. I had a traumatic birth with my first child. My epidural procedure failed after the needle was jammed into my back, despite asking them to stop. I was alone during that procedure with no one to support me or ensure I had a good birthing experience. The injection sent immediate pain through my neck and up my skull. I birthed my daughter with an oxygen mask, and I blacked out the first week of my baby's life due to the excruciating spinal headache. My mother was with me to help me with the transition into motherhood. She left when Milea was 2 weeks old. I was alone, no one to help, no community. I was trying to forget my traumatic birth story, heal from the infected wounds, and bond with my baby despite the lack of sleep. All of this while navigating my anxiety and depression that started creeping in during my pregnancy. Next slide, please. I remember holding my baby and crying, wondering what I had done to feel so distant. I tried to explain to my pediatrician what I was feeling. I again was told it was normal. Next slide, please. The days, weeks, and months passed. I sank deeper into desperation, feeling guilty, distant, and helpless. I called my mother crying, asking for help. I cried because I felt like I was failing as a woman, as a mom. I was trying every single day, praying, anything really, trying not to give up. But there were days I felt like not waking up. Survival was slipping through my fingers. I didn't know what to do or how to get help. Finding help felt almost impossible. Through my tears, I remember having to feel vulnerable and tell both my OBGYN and my pediatrician I wasn't okay. They asked me if I had thoughts of harming myself. I did not at that point, but living also felt really hard. I was referred to an agency for help. Weeks went by before anyone called me. I asked for a Latinx provider because I felt like I needed to express myself in my native language, and I felt it was important to seek support from someone who knew my experience. There were none. I was finally matched with a provider who had expertise in maternal mental health, but did not speak Spanish nor identify as Latinx. Unfortunately, they did not show up to our first consult. The whole process felt draining. I had slipped through every crack and never received the care I needed. I experienced this living in a city known for their medical innovation and maternal mental health systems in place. This was Boston, Massachusetts. Fast forward a couple of months, I had moved across the country to Seattle, Washington. Here, my feelings of depression continued. Through my pediatrician's routine depression screening, he realized something was not right. He referred me to a community organization that had Latinx peer supports that provided me with community and comfort. There, I was also connected to a Latinx maternal mental health therapist. This network, composed of my pediatrician, my therapist, and the community organization, continued to support me today. My second child has severe dietary allergies and has faced a really difficult first year of life. Camila stopped gaining weight for 3 months and continues to navigate painful skin lesions due to her dietary allergies. She can only have one formula, and the formula shortage has only made things more difficult for all of us. My feelings of isolation and fear have crept back, especially as I am constantly searching store to store for the one can of formula her body can take. Our network has supported us through the illness, through my anxiety, and again now with my second child through this formula shortage. Next slide, please. So where do we go from here? My experience isn't unique, but my experience is that of mother with a graduate level degree, with medical insurance, and with the knowledge of navigating the siloed health system that lacks maternal mental health integration. I asked for help because I knew something wasn't right. I knew what postpartum and anxiety and depression were. Even then, I couldn't get the help I needed when I needed it. I share my experience in 2 places because in one place, the medical system didn't recognize my need for help. In another place, my child's medical provider had the training to recognize and refer to a community agency that matched my cultural needs. The community agency supported me and connected me with the supports that I needed. My story is an example that all levels of support are needed to help our mothers. My story also shows that when moms are not taken care of, our children are not cared for. If we care about our babies, we must care for our mothers and caregivers. My story is a call to action to create systems and pathways that are accessible, timely, and responsive to help moms survive and thrive, to train and bring knowledge to the medical community to improve screening, diagnoses, and referral to concrete supports, to support community efforts and workforce development that allows all moms to see themselves in support. This is important more than ever. So I leave you with this quote: providing maternal mental health supports not only heals our mothers of today, but it also heals our mother's mother and our future mothers.
Mariel, so thank you so much for sharing your story. We know that every time a new mother hears the story of another mom who has struggled, that mother is then empowered to talk about her experience and reach out for help. So we are so grateful for your honesty and for your emotional tribute, and just so grateful for your time. And we did notice that you spoke during this, during your story about the infant formula shortage, and just wondering about how, if you could shed a little bit more light on how you're feeling about that, and how do you think the formula shortage is affecting other new moms?
As I share, it is really scary to have to be in a position where you just don't know where you're going to get that next sort of feeding for your child. And, you know, in my particular situation, my child had to try a vast majority of formulas, including the most hypoallergenic formulas, and she did not respond well to them. And so I think about the parents who have to make the really hard decision of giving their children whatever they can find, even if that means that there could be further medical or health issues. And that's just a really awful place to be as parents. You know, not only the anxiety of, you know, having to, you know, go store to store and search for any can, but knowing that you might have to make a really difficult decision and possibly put your child's health in jeopardy is just a really hard place for parents to be.
Thank you for sharing all of that. And we realize once again that there are so many things that impact mom's mental health, things that we could never have imagined, like a worldwide pandemic and an infant formula shortage. So thank you again, Mariel. We are so grateful for your being part of our discussion today.
Thank you all.
So our next speaker is a dear friend and colleague, Joy Burkhard, who is the founder and executive director of 2020 Mom. Joy not only brings over 20 years of experience in the insurance industry, but her family has also been touched by mental health conditions. Joy is a passionate advocate for mom's mental health, and she's going to talk to us about the work that she has led in California. Thank you for being with us, Joy.
Great. Thank you so much, Adrienne. And we can advance to the next slide. A little bit more about 2020 Mom. We are a 10-plus-year-old organization whose mission is to close gaps in maternal mental health care. Next slide. Our core project work includes convening thought leaders, issuing reports and briefs, and providing technical assistance on policy and healthcare systems change. Next slide. I wanted to re-emphasize that there's a range of maternal mental health disorders. It's not just postpartum depression, and share that new onset of these disorders happen nearly as frequently in pregnancy as they do in the postpartum period. And we also need to be very concerned about the high numbers of young childbearing age women with pre-existing and untreated anxiety and depression. As we heard, the formula crisis is adding fuel to the fire. Next slide. I wanted to point out that suffering is extremely profound in some cities, and most notably in Houston and Phoenix. Mothers there have been suffering severely, both by the formula shortage and having the highest rates of maternal depression in the country. Next slide. The field of maternal mental health is complex. There are many multifaceted barriers that both patients and healthcare providers face, and there are certainly no one-size-fits-all nor simple solutions. Next slide. Well, why is this, you might ask? Our research has shown that there are 4 Ps, or 4 primary barriers and opportunities. The first is prevention. Here in the US, we fail to provide young families with basic social services and supports like paid family leave, childcare, addressing social determinants of health, including food and formula insecurity and racism, and providing healthcare coverage and community-based supports. The next P is payment and payers. The separate payment system for mental health care in America, called carve-out system, complicates access for both providers and patients. Providers, most perinatal providers, those that serve women in pregnancy and the postpartum period, lack formal maternal mental health education. We're also facing severe and significant OBGYN and midwife shortages, what we call the maternal medical home. There are severe mental health provider shortages. And finally, there's misalignment with reimbursement to incentivize detection and treatment of these disorders. And the last P is performance measurement. In a fragmented health system like ours in America, a framework for quality measurement and national reporting that helps implement a standard of care and hold payers accountable is a must. Next slide. As we know, health systems change in the US largely lies with the states, and states are really beginning to take action, from declaring May Maternal Mental Health Awareness Month to forming task forces and mandating provider action. Next slide. Several states have formed task forces, including California. I want to share a little bit about what that process looked like. The task force in California was formed at the urging of the state legislature and included multiple public and private players, and called for a report to be issued back to the legislature and to the public. The task force studied the maternal mental health research and the field. It identified multifaceted barriers and opportunities similar to those 4 Ps that I mentioned earlier. And finally, it issued recommendations to cross-sector players, including payers like private insurers and Medicaid agencies, hospitals, community-based organizations, provider associations, and government agencies. Next slide. You might be asking, Has the federal government done something like this? What has been done by the federal government? And many of you may remember the reports that were issued in late 2020 under the prior administration by the Health and Human Services Agency, HHS, and the Surgeon General. And those reports really focused on the maternal mortality crisis. What did those reports say about maternal mental health? A little bit, and I'll go over what those reports said. First, there was a call to action to extend Medicaid 12 months postpartum for substance use disorder. The framework also called for the creation of a provider maternal safety set of guidelines for the postpartum period, but not specific to maternal mental health. The guidelines also suggested postpartum depression be addressed for those with access to home visiting programs. And the report called for running a challenge to identify programs with promising outcomes addressing postpartum depression in rural communities. And finally called for an awareness campaign to ask women to tell their providers when they're suffering. While these steps are small steps in the right direction, they focus only on the postpartum period. And in one case, I believe is ill-informed by asking women to speak up rather than recognizing when a woman does speak up, often help isn't available. Next slide. Lastly, I wanted to emphasize that extending Medicaid coverage through the postpartum period is foundational, and great progress has been made there, not limited to substance use disorder. And yet we know that the health system is still not positioned to diagnose and treat these disorders. Next slide. And so what is the solution? As Adrienne mentioned, the Triumph for New Moms Act calls for the formation of a task force at the federal level that would work similar to California's task force to study and understand the complexities of the problem, to develop a national strategic plan that includes actions each federal agency can take, and also would issue recommendations to the states. This is foundational and a foundational step for mothers, communities, and providers across the country. Thank you.
Thank you, Joy, for your many years of work in the field of maternal mental health. You have helped move the needle more than you will ever realize. And we're so grateful for 2020 Mom taking the lead on the Triumph for New Moms Act. And we want to encourage policymakers to co-sponsor this important piece of legislation. So I have one quick question for you, Joy. Since you recognize that the Department of Health and Human Services is doing some work, we know they have work groups addressing maternal health. What do you think? Should HHS also address maternal mental health? And if so, what would that look like?
Yeah, I appreciate the question. There are some existing work groups addressing maternal health, which is critical. And we, applaud the important work that HHS and federal agencies are doing there. But as I mentioned in my presentation, maternal mental health is very complex, and it deserves deep and undivided attention by HHS and our agencies. And that's what's needed to solve the crisis in America. And further, the Government and Accountability Office, the GAO, found in a study that they did of maternal health work within HHS that the work group members that do exist reported competing priorities, and that the federal agencies struggle to coordinate. This temporary task force that the Triumph for New Moms Act calls for would prioritize maternal mental health and provide for these critical structures to ensure proper coordination and prioritization. Thank you for that great question.
Yeah, thank you. I do want to just reiterate, and you'll hear this over and over again, mental health issues are the most common complication of pregnancy and childbirth, and we ought to do more. I just want to point out that the United States Preventative Service Task Force has given the same recommendation, a grade of B, for screening for gestational diabetes during pregnancy, as well as for maternal mental health issues. Gestational diabetes affects about 6% of the pregnant population, and yet there is almost universal screening. Meanwhile, maternal mental health conditions we know affect at least 20% of the pregnant and postpartum population, but screening is left up to each individual state, health system, hospital, obstetric group, and provider. So we have wide disparities in screening that we do need to address. And when I talk about screening, I also mean education. So thank you, Joy, for, again, all of that work. And we're hoping that if Triumph passes, that this is the kind of work that this task force will highlight. Okay, so our next speaker is a delight to introduce Dr. Mary Kimmel of the University of North Carolina at Chapel Hill. Dr. Kimmel is a reproductive psychiatrist with training in both psychiatry and obstetrics. She leads a statewide effort in North Carolina to address maternal mental health, and she'll be talking about that program. Thank you for being with us, Dr. Kimmel.
Well, thank you for having me here today. And I'm so honored to be here to advocate on behalf of my patients, their families, my colleagues in mental health, and my colleagues who are on the front lines in pediatrics, obstetrics, family medicine, and working in general medicine. And I want to just say that the reason I think our program is very aptly named, because when we support maternal mental health, it truly does matter, and that the positive effects of that reverberate through our communities when we focus on maternal mental health. Next slide. So my work as medical director of NC Matters has been made possible through the 21st Century Cures Act and through a non-federal match, which I think has been critical to help us overcome those barriers to get a program like this going. And today I'm excited to show you our successes. Next slide. So this work really takes a team, and over the past 4 years, we have been able to bring together an amazing group of individuals who have diverse expertise as well as diverse backgrounds that has made our team stronger and has made our successes possible and has made our dreams, made us think about new dreams. Next slide. But I always, at the center of this is always our patients and the individuals of our state. And so these are the kinds of things that we have heard actually prior to the pandemic, throughout the pandemic, and now with the infant formula shortage. And what I want you to think about is how complicated it is to look at these and to know, are these worries adaptive? And many times they are adaptive. And when are the worries that are keeping individuals and families from having the kinds of lives that they want? And thinking about the amount of strain that that's having to go through these thoughts is having for different families. And also, I think it really highlights that mental health needs, that any one of us can have greater mental health needs at different times, depending upon the things that are happening. And I think the pandemic certainly showed just how many people are dealing with depression and anxiety. Next slide. But one of our barriers has been a shortage of mental health providers. And you can really see that in North Carolina. That's very well shown by this map, where really 90 of our counties are considered to not have adequate numbers of mental health providers. But we've learned from collaborative care. So in collaborative care, we take expertise, mental health expertise, and we take the expertise of people who know their patients and they know their communities, and we bring that together. And so our program strives to do that now and use those same ideas and to do that across the state and to really bring collaborative care to trying to address some of these issues. Next slide. So our program entails education. I will say yesterday, actually my program manager and I did a half-day training for 11 providers from 11 counties just yesterday. So, our education is really to help people understand screening, to feel empowered, to have up-to-date evidence-based knowledge. We know, though, it doesn't stop there, that people need in real time, providers need to be able to discuss issues that come up. And so we have a consultation line that is from 8 to 5, where we can specifically talk about, specific questions such as this medicine that my patient is taking. What do you think about that? As complex as this patient has a number of complex needs and all around in her life, and how can we problem solve together and support one another, supporting her and her family. And of course, that means we have to have resources to connect people with, and community. We must be connected with the communities and be able to direct people to resources in their communities. And finally, telehealth has really been a game changer for us. It has enabled us, we have many rural counties, it has enabled patients who before would have had to drive, and many of them may not have been able to make that drive to centers to get expert care in perinatal mental health. And now we're able to use telehealth to meet with that patient and to help her team and her come up with a wellness plan. Next slide. We've found great partners in this, and we've really found ways to amplify their work and for them to amplify our work. And one example of that is working with the Perinatal Quality Collaborative North Carolina. And we've been bringing together our efforts in terms of screening and helping screen both for substance use disorders as well as other mental health needs, and to bring that even beyond screening to really conversations that lead to helping people get connected to the resources that they need. Next slide. And as you can see, we've got hearts in a lot of our counties. I'm still, working to get hearts in the other counties. Those are all counties where we've had providers call. You can see we've had real success in getting, we've had many providers calling us and many providers trained. But I also want you to think about those numbers also don't reflect how that is reverberating out, and that each of those calls means that person feels better and more empowered, and they're also sharing that with their colleagues and with their community, with their patients and with their communities. Next slide. And you can see our calls continue to go up, I think reflecting that really. The other thing I want to point out is that from my calls with providers, I've really learned how much we support one another. We know that one of the biggest issues and one of the reasons we have a provider shortage is because of burnout. And so we provide this ability for us to talk and to connect and to problem solve these things and to empower one another. And so I think that's why we continue to also see continuing growth in our program. Next slide. And we're not just, we're initially targeting OB providers, but we know that we really need to be able to change family mental health. We need to be able to be targeting lots of different providers. And we're proud that those numbers are growing. And I think but it also shows where we continue to want to make growth, and we want to continue to expand other specialties that we're also supporting. Next slide. And this has been interesting for us, that how much we've been supporting and the growth of support of psychiatric providers. And again, I think that comes back to the challenges that we're all facing, and we need community, and we need to be able to have ability to support one another. And that I hope that actually helps mental health providers stay in their communities. Next slide. So these are the things that we've learned where there's still gaps, and some things that we know where we want to go. We know that we need to continue to create support and teams that cross into communities, and that we have more people representing diverse communities, and that we can provide support to and learn from. We also want to continue to change the conversation from just thinking about each individual to thinking about the mother, parent, and child together, thinking about the family. And we, would love to see moving towards family mental health community hubs. And I really believe that sends a message to communities that our mental health is important, and the strength of that can really reverberate out through the community. And finally, we are all also always excited about innovating and thinking of new ways to get access to people, but making sure that that's done in an evidence-based way. And so we have multiple ideas on directions to try to increase access in new ways. Next slide. And I always like to end on this thought, bringing it back to our mom, that it is really, and Mariel, I think, the strength of her is the strength, like she pointed this out so beautifully, thinking about how mothers impact the future mothers. And so a healthy mom is critical to a healthy baby, but I also want us to remember that each individual deserves support and mental wellness, and that when we do that, we do have stronger communities. Thank you.
Thank you so much, Dr. Kimmel, for being with us today and for dedicating your academic career to finding ways to help new and pregnant people. So grateful for all that you do. So I have a quick question for you. So you discussed your psychiatric access line that helps providers treat maternal mental health conditions. I'm wondering if you could walk us through the kinds of questions that you receive, how long these calls typically last. I know there's probably a whole variety of different things, and what kind of follow-up you provide those who reach out for help.
Yeah, that's a great question. So we have the gamut of questions. Some of them are very simple questions that take, really 5 minutes of, a question about my patient's on this medicine. I've never seen someone in pregnancy taking it. What do you think? And we have a good conversation about it. We can bring up if there's, recent data on that medicine, but also just helping them really navigate how to have the conversation of risk with their patients. So the risk of not taking it versus the risk of often, sometimes even just really that we can't say there's no risk to a medicine. But that also goes to as complex as I've had 30-minute conversations with wonderful therapists in the community, talking about complex issues that their patient may be having, really bringing together complex social determinants of health needs, and really how and different ways that we can problem solve together. The other thing that we've learned, and this is why I think for us to continue to grow, we want to expand our behavioral health consultants, is we know that for a lot of families, we need to continue to have support in terms of trying to help them make sure they're getting connected. There are so many barriers they're facing. That first step is often a step in a road, and we need to be able to check in and do things along the road to support them and to support their providers. And so that's where we're doing a lot of that work. And so our call goes beyond that 5 to 30 minutes to this other work, but we also are wanting to be able to expand our ability to do that.
Well, thank you again. And expansion is a word that I'm going to build upon here. As we noted earlier, North Carolina was one of the 7 states to receive this initial set of funding from the federal government. It was 5-year grants that funded programs in 7 states from fiscal years 2018 to 2022. The Into the Light legislation would reauthorize those programs and expand them, asking for funding to provide grants to at least half the states so that more moms can get the help that they need, and more providers can be educated about these issues and how to educate and screen and treat their patients. So we'll keep pushing forward on the advocacy front for additional funding for Into the Light to expand these types of programs. So thank you again, Dr. Kimmel. And finally, our last, but certainly not least, presenter is Kay Matthews of the Shades of Blue Project in Houston, Texas. Kay is a certified healthcare worker, and she has led Shades of Blue to support new mothers with both their mental health as well as basic needs, like providing formula, diapers, and wipes. Community-based organizations like the Shades of Blue Project provide an all-important safety net, especially for low-income women and women of color. Kay, we're so glad that you're with us today. Please take it away.
Thank you, Adrienne. Next slide. So a little bit about the Shades of Blue Project. We are based in Houston, Texas, and we're dedicated to helping women of color before, during, and after childbirth with community resources, mental health advocacy, treatment, and support. Our mission is to continue to work within hospital systems that will help us better address the issues that we're currently experiencing around maternal mental health outcomes. Next slide. And so a little bit about the social support services that we provide. Maternal mental health support groups, both virtually and in person. We also have on-site counseling services, free clinical health screenings, job placement assistance. But one of the biggest services that we offer in conjunction with our maternal mental health support is the basic necessities. What we have learned over time is I can have a lot of things going on as a new mom, or a mom who has 4 or 5 children. Each child and each birthing experience is different, right? But one thing for sure is if you're trying to get me into a support group and I'm worried about how I'm going to pay rent, get diapers, get formula, all those different things, I have disconnected from that conversation. So how we serve is how we put the person who is sitting in front of us first. We address what their needs and what their wants are first. And clearly it is about getting them the basic necessities. So we lead with that, and then we follow follow up with the other things, because what you have to have is buy-in. When you're supporting moms, birthing individuals, you have to have their buy-in. And so you have to support them in a way that they need and want. Next slide. And so when we've heard from my colleagues about some of the staggering numbers that African Americans have the highest mortality rate of any racial or ethnic group in the United States, and higher rates of preterm births explain more than half of the difference. So we have an issue. We know what this issue is. What we have to start looking at is the tie-in of the two, the tie-in between what is happening in the maternal health space, which is also happening in the maternal mental health space. Next slide. And so I will always present from the community voice. I will always share with you the things that we hear on a daily basis. I'm too busy to take care of my baby. What that really means is I'm not putting everything else first. I am trying to balance. And we don't even have to have children to know that as an adult, trying to balance can be difficult. And so when you add in a lot of different other factors, you have to think about what the mom and what the birthing individual is up in just parenting just as a whole. My mental health is not that important. This is why we talk through what they need first, because their mental health may not be important because no one ever told them or showed them that it is. So we work through what that process looks like. I can't afford to take off of work is a huge one, because what we already are experiencing is a loss, right? Not enough revenue, not enough income. Even if we're thinking about the formula shortage as a whole, that thing was happening actually before the nation knew about it. Because we work from sun up to sundown, taking phone calls from moms, we know that this shortage has actually started before people knew about it. And so if I'm struggling in my everyday things, and then you keep throwing things at me, how mentally debilitating is that? So if we're not taking in account in any situation the mental health of these individuals, this is where we're losing. This is where the fight gets a lot rougher than it has to be. We got to stop. We have to stop and start paying attention to all of these different factors. Next slide. And so we know the problems, but I'm more solution driven. So here are some of the solutions that we know work. We certainly know and will continue to hear about one-on-one models, meaning peer-to-peer support, meaning I can identify with what you're going through, see how we can work together. Shared decision-making. You cannot make decisions for your clients or your patients without them. You have to inform them and then make that decision with them. It works out a lot better. When we think about, I think so often one of the examples used is the patient who misses an appointment continuously, right? Shared decision making. Are you talking with her? Are you seeing like what's going on behind the scenes? Why is this happening? We have to slow down just a little bit. But that shared decision making is what we have to start to lead with. And then we know group models like peer support led groups, structured and support group support still work as well. And then community health worker programs, because as a licensed community health worker, I know the strides that we take, the hands-on community engagement that we have, and that partnership that is needed with other healthcare professionals is imperative going forward. Next slide. And so our collective efforts within the Shades of Blue project have been through our Inspire method, which we created for the community with community involvement. Next slide. And so we know that traditional approaches, or what we've seen is traditional approaches to addressing postpartum depression or any maternal mental health complication amongst women of color have proven to be lacking based on our numbers, and you're seeing them. The Inspire method presents what we call a non-traditional approach, which is a journal-based program that we created. I personally come into this work from my own experience. I struggled in the postpartum period because no one was tying infant loss and postpartum depression together. They just weren't. And so I struggled to find my own way and to create something for myself. And when I created it for myself, I had to share it, because I'm a firm believer that if I'm struggling, I'm not alone, but I need to share that so someone else doesn't feel alone. So the Inspire method was created from my own experience of journaling, writing those things down, coming up and trying to stop the insanity that was really happening. We talk about insanity, but we don't really explain it in an effort. What I wanted to do on a daily basis is figure out how can I do something that is going to make me wake up every day. And that ended up being the word inspired, but it needed to be more than that. Next slide. It needed to be something that I could do on a daily basis, involve others, which was asking for help, which is something that can be difficult sometimes, because if you don't know what kind of help you need, it's difficult to ask for help, right? But surrounding yourself with folks who will be able to help you navigate what help actually looks like. Nourishment and exercise. Nourishment is just at some point in time eating in that day, in that period, taking time to do that. Exercise is moving. I call movement, singing, dancing, getting up, moving, not sitting in my chair all day, thinking about it from the most basic level of how we are approaching this. Spirituality and prayer. I know within our culture, religion is a big piece. It can be hurtful at times. It can also be good. And so we can't leave it out because it makes us uncomfortable. So spirituality and prayer is kind of where we sit. It's a medium to be able to have a conversation with folks without it ending in some type of battle. Patience, we're not born with it. It's something that we learn over time, but it is necessary in this process. In order for things to change, you first have to identify it. I think we skip over when someone walks up and says you need to change that and they're not giving you any details, you have to identify that for yourself. So identify and initiate change is the next I. Rest and relaxation. Nobody on this call is getting enough rest and relaxation, including myself. And so I have to figure out ways throughout the day to be able to do that. It's imperative to just our overall health. And then the blame, because in this space, blame is a big part of it. Why is this happening? Is it something that I didn't do right? All of the what ifs and the whys. Each day is a new day to start again. And what that meant is every day I woke up, I got to inspire myself again. If the only thing I did that day was wake up for the next day, I still learned to inspire myself. And so we teach this method to our clients, to doctors, nurses, anybody that is going to engage with a client or a patient, because you have to utilize this for yourself before you can share with others. It makes it a lot easier, and it just really comes down to putting compassionate back into our interaction with individuals. Next slide. And so what have been our successes in using this method? Next slide. If our moms decide that they want to go through the Inspire, so they're participating in the group, they can also in like 6 to 8 month time frame say they want to be a trainer, we train them to be a trainer. So we're putting them back in the workforce in many ways, training other leaders, again, doctors, nurses, training local national programs such as Healthy Start. We've created a summit from this work as well, and we are the creators of Black Maternal Mental Health Week. So this is our solutions in action that also bring awareness. Next slide. And so what has been our biggest lesson learned and key takeaway, and I always want to share this with folks when I present, next slide, is our acknowledge, respect, and support method is key. Acknowledgement just simply means I see you. So many of us don't feel seen. We feel like a number when we walk into these spaces. We feel like the next person. So again, acknowledging the person that is sitting in front of you, respecting them, not where they are, because where I am today is certainly not where I was yesterday, and I may not be there tomorrow, but respecting me where I am and giving me that, and then supporting me in a way that I need and in a way that I want. Next slide. And so I want to end with this quote: we are the solution. The community is the missing link within a lot of conversations. It is imperative that when decisions are being made, that someone from the community is not just sitting at the table, but is involved in the conversation, that their voice is heard and that their voice is honored. Next slide. And then this is us. I always want to share some of the things that we do out in the community, some of the clients that we love and we serve, and we continue to do this work again from a community lens, for the community, by the community. Thank you.
Oh, thank you so much for the work that you do, for your wonderful presentation, and for really emphasizing and focusing on patient-centered care. And that's what we all really need to be doing, focus on the patients. So I have a quick question for you, Kay. I'm wondering if you can share a little information about why do you think Black and Brown mothers may be more likely to go to a community-based organization like Shades of Blue as opposed to a medical organization?
Because we experience such harm within our medical care systems. We want to identify with the persons that we are sharing our intimate information with. I mean, there is a time and a place for both. And so we see the barriers that exist within. I have to sometimes talk my clients into going back to these hospital systems or back to these clinics, even if it entails us going with them or having a conversation with the providers there. But we have to start again to see the value that community brings into the healthcare system. We won't have these issues if we are partnering together and we're really working together, because if just thinking about it from a family position, if my auntie tells me something, I believe her and I'm going to roll with it. So the aunties, the grandmas, they're looked at that's what a community-based organization is. You go there, you get the comfort that you need, you're talked to and you're treated how you should be. That should be the same within our medical care. And so there has to be a collaboration between the two that, again, truly values and honors what is happening in our communities.
Yeah, I just remember so much when I was going through postpartum depression. All I wanted was for somebody, some grandmother aunt kind of person, to basically give me what I call the virtual hug and say, it's okay, honey. Well, people go through this. We are going to get you connected with resources and you're going to get well again. Yeah, love this idea of the virtual hug. So we just have time for a couple of questions. Kristen dropped something in the Q&A about, do you think it would be helpful to have a mental health urgent care for mothers that would be more beneficial for the government to approve? And Joy, I know you typed something back in the chat. Could you just share what you responded?
I'll just share that those who have been following the larger mental health field have seen that there is a movement to create mental health urgent care centers. And we certainly believe that those centers would be very beneficial to mothers as well. And of course, those centers be trained in the nuances of maternal mental health disorders. Right now, we often see that women finally do speak up. Maybe they haven't been screened or have spoken up with one provider, not received the treatment they deserve, as we heard from Mariel, and then finally do decide to go to the ER because things are so challenging, and they are held for 72 hours, perhaps without access to their babies, finally see a psychiatrist who releases them after doing a review back into the home and community without a treatment plan, without a provider, and without a diagnosis. It's just not working. So the concept of urgent mental health urgent care really would matter for mothers.
Absolutely. So we are just about at the end of our hour. We want to be respectful of everybody's time. We, again, are so grateful to our presenters today. And we do have one more congressional leader who is going to share some information with us. Representative and Dr. Larry Bucshon, Republican from Indiana, is leading the Triumph for New Moms Act, which would create that national task force and strategy that Joy had mentioned. So we have a short video from Representative Bucshon to close out our presentation today.
Hello, I'm Representative Larry Bucshon from Indiana, and I'm excited to join you all virtually here today at the Maternal Mental Health Leadership Alliance virtual congressional briefing. With Indiana having one of the worst maternal mortality rates in the country, I am proud to lead the Triumph for New Moms Act, which aims to establish a no-cost interdepartmental task force to address the U.S. maternal mental health crisis by closing gaps, eliminating duplication, and coordinating federal resources towards maternal mental health. This task force would also work closely with state governors to alleviate the maternal mental health challenges in their states. Current federal efforts to support women suffering from maternal mental health conditions lack coordinated action and organization towards this issue, and as a result, 50% of these moms never receive treatment. This bill will increase mental health support for pregnant and new mothers by offering targeted solutions that have proven success. As I work with my colleagues on passing this important piece of legislation, I appreciate your advocacy in pursuing better support for future generations of mothers and children. Together, we can tackle this crisis and improve maternal mental health conditions in new mothers and their children. I look forward to continuing to work with you all as we get this bill across the finish line. Thank you again for your dedication and commitment to the Triumph for New Moms Act and I hope you have a great briefing.
Great, thank you so much. So somebody did type in the chat, is there a call to action? Yes, there is. Please contact your elected officials and encourage them to support the Into the Light for Maternal Mental Health and Substance Use Disorder Act and the Triumph for New Moms Act. And we will also be advocating for including community-based mental health, maternal and mental health organizations and services in the formula response to address the mental health effect of the infant formula shortage. And here's a link to the March of Dimes website that actually has a very easy to fill out form to support some of these pieces of legislation. Next slide, please. Again, we will send out the presentation and the recordings following the briefing. And again, if you have any questions, you can contact Emily E. Rosenberg at mmhla.org. Next slide, please. And thank you again to 2020 Moms, Shades of Blue, and our various partners, and for Sage Therapeutics to support this briefing. And final slide, thank you, all of you, for taking time to be with us today, for advocating on behalf of new moms and families, for helping those new moms and families get off to their best start possible. Thank you and enjoy the rest of the day.